Uh, well, friends, welcome to today's webinar, and we have Dr. C.M. Kamaal today with us. He's an associate professor in Department of Pharmacology and Therapeutics at SMMH Government Medical College, Saharanpur, and he will be speaking on demonstrate the understanding the competency 2.1 to demonstrate the understanding the use of various dosage forms. Solid dosage form. Over to you, sir.
Thank you, sir. Good evening, all. So today I have chosen again the another session of the practical pharmacology, since I'm more interested in developing the newer modules of pharmacology practical curriculum. So this is the second presentation, and it is related to competency number PH 2.1, practical pharmacology for MBBS undergraduates, and it's demonstrating the understanding the use of various dosage forms. So it has included all the dosage form, but I have subdivided again it, and today I am taking into discussion the solid dosage form. If time permits, the other dosage form we will be discussing some other day. So today I will be discussing the solid dosage forms. At the end of this session, one shall be able to distinguish characteristics and applications of different solid dosage forms in clinical practice, discuss the importance and the reasons for using different solid dosage forms, develop critical thinking and problem solving skills while using these solid dosage forms in clinical practice. Now, before I can go ahead with the topic, just have a look what is the dosage form. Dosage forms are the means by which drug molecules are believed to deliver to the site of action within the body. So it is important to have understanding why we need different dosage form, as we know that a single formulation does not allow us to administer a drug via different routes. For example, if you are taking a drug in tablet form, if it is suitable for oral administration, but it cannot be administered by parenteral route until it is diluted in a sterile solvent. Even you cannot administer a tablet into the rectum. Thus, suppository specially designed formulations is prepared for administrations into this route. So the physicochemical properties of a drug can be easily altered by different dosage forms. It conceals the bitter, the salty or offensive taste or odor of the drug. The damage of drug from moisture can also be prevented. It protects the drug from destructive influence of gastric acid after oral administration. The increasing the acceptability of drug. For example, if you are taking the example of the metronidazole, which is having a bitter taste, it can be masked by making metronidazole tablet in a film coated preparation. So the film coated preparations also prevent the damage of a drug from moisture. Say for another example is the benzyl penicillin. It cannot be administered orally because it is being destroyed within the stomach by gastric juice. So it is always administered parenterally. So it is the importance of understanding the why we are needing the different dosage form. And as such, we know that liquid dosage forms are more acceptable to the children as well as elder patients. Again, there is have a look needing of a different dosage form for the accurate dose, protection from physical environment. We are coating the tablet for this purpose. Protection from gastric juice. Examples are the antric coated tablets. Masking the taste and odor from the medication. Placement of the drugs within body tissues. Sustained release medications or the controlled release medications for the requirement of optimal drug action, for the purpose of insertion of a drug in various body cavities, say for example rectal or vaginal, use of desired vehicle for insoluble drugs. So as such, single dosage forms of various drugs can exist. Say for example, the various drugs are available in single dosage form. Say for example, tablets of paracetamol, amoxicillin, ranitidine, or various dosage forms of a single drugs can also exist. Here I am quoting the examples of ondansetron, the drug that is being used for the purpose of nausea and vomiting. So the various dosage form may exist for a single particular drug, says different medical conditions can warrant different routes of administration. So as such, AMSET, which is the trade name of the ondansetron, it is available in the form of the tablet. It is available in the form of the oral solution, and also it is available in the form of the injections, which can be used for the intravenous route or intramuscular route. Here I am showing you the vomicaine strip. This is ondansetron disintegrated strip, which is usually being capped at the base of the tongue. It is producing very quick results. I am having a clinical experience of using this. This is almost akin to using the intravenous injection. It is producing its effect in cases of the nausea and vomiting within minutes, say for example 5 or 6 minutes. So the different oral dosage forms are there. They can be tablets, they can be capsules, there can be powders. As we all know, the most common dosage forms are tablets and capsules. Also, we are having some another less common solid dosage forms, say for example, effervescent salts, powders, granules, and various lozenges. Now, before I can go ahead in into the discussion, we just have a look, just having an understanding what is the excipient. So as such, we know that a medication tablet, which is, say for example, having the 500 milligram, the active ingredients may not be 500 milligram. It may be lesser than that. So as such, in active substance, the tablet may be more weight than the 500 milligrams. Say for 500 milligram tablet may be weighing 900 milligram or 950 milligram. So apart from the ingredients, the tablet is also having inactive substances that serves as a vehicle or medium. All these are known as excipients. These are the things, say for example, coloring agents, various preservatives, and fillers. So a medication is consisting of the active ingredient along with the excipient. So which this excipient is conferring a therapeutic enhancement to the active ingredient in the final dosage form. This excipient can also be useful in manufacturing process by pharmaceutical industry, and it is also helping us in handling the active substance of a medical preparation. So excipient aids in providing the stability, such as prevention of the denaturation. Now coming to the tablet are the almost most widely used of all dosage form by the definition, and a tablet is a solid medicated dosage form with or without suitable additives, and it is usually made by the pharmaceutical company by the with the help by compression or molding. They are extremely convenient dosage form because they are having very ease and which they can be delivered to a particular person in various clinical conditions. So just have a look on the constituents of a tablet. It is having active ingredient, diluent, lubricant, disintegrant, and binders. The active ingredient is the chemical substance intended to produce a desired pharmacological effect. A diluent is a filler which is providing an extra volume for the tablet, say for example lactose, starch, dibasic calcium phosphate, microcrystalline cellulose. Due to different quantity of the diluent added to a tablet, or say for example 325 milligram and a 500 milligram tablet, they can be of same size. So it is the quantity of the diluent which can be different, which is making these tablets of same size. Apart from the active ingredient and diluent, the tablet is also having binders. Binders are the substance that hold the tablet together. Various examples of the binders are microcrystalline cellulose, acacia, gelatin, sucrose, povidone, methyl cellulose, carboxymethyl cellulose, and apart from that, the tablet may be having disintegrant, which is helping the tablet to break apart and dissolving in the gastrointestinal tract. Many disintegrants act by absorbing water and splitting the tablet into many small pieces. They are most widely used disintegrating agent in the most widely used example of the disintegrating agent is starch. Apart from that, we are having sometime in the tablet lubricant. Lubricant is a substance that is serving two functions. First of all, it is preventing the wear and tear on the tablet making equipment when tablet is being manufactured by the pharmaceutical company, and second, to make it easier to remove the tablet from the mold during the process of manufacturing. Here I am showing you a video which we are showing here in our Department of Pharmacology during the practical of the solid dosage form. In this video, it has been shown how these solid dosage form are being actually manufactured by the pharmaceutical companies. Showing these kind of the videos, as we have observed in our department, it is inciting a kind of the interest the students about the use of the solid dosage form. Just have a look on this video.
Hello.
Hello.
Yes, sir.
Can you see the video, sir?
We can.
Can you see the video? How the tablets are being manufactured?
Yes, we can see.
Now it has stopped. Dr. Kamaal. Dr. Kamaal. Hello.
Dr. Kamal has gone offline. मैं कॉल कर रहा हूं उनको. Dr. Kamal's net has gone. He's just coming back.
Okay.
Anji sir, we can see your screen.
Hello, sir.
Yes, we can see your screen.
Sir, can you see the video?
Yes, sir.
Okay. So this is the molding of the tablet which is being shown by the video. See, this is the coating of the tablets, which is making a coating on the thousands or millions of the tablets together. So these is showing the tablet without coating and with coating. This is the filling process of the tablets. So this is the manufacturing of the capsules. So during the process of discussion or practical, when we are showing these kind of the videos, these are just to generate an interest for the practicals among the undergraduate students. So in this video, I have shown you the manufacturing of the tablets and the capsules. Now coming to the advantages of the patients. For the patients, tablet as such have the advantage of accuracy of the dosage. They are having compactness because so they are easy to use. They are having the advantage of the portability. So carrying the tablet from one place to another place is easier as compared to the other dosage forms. They are bland in taste. They are very easy to administer So ease of administration is also associated with the tablets. For the manufacturers, there is a purpose of the simplicity. There are economic reasons associated with the tablets. They are more stable as compared to the other dosage form. They are convenience in packaging, shipping, and dispensing. Now coming to the scoring in a tablet. So a scoring is a debossed line that is running across the planar surface of a tablet, and it is being produced in the tablet for facilitating the breakage of the tablet, breaking of the tablet into fraction when less than a full tablet is being required. So a drug manufacturer may score the pill with a groove to both indicate that the pill may be split and to aid the practice of a splitting purpose. When manufacturers are creating a groove in the pills, the groove must be consistent for consumers to be able to use them very effectively. Many manufacturers may choose not to be using the grooves. The regulatory authority are often making certain kinds of the recommendations for manufacturing the scoring on these tablets. Understanding the scoring in the tablet is important because I have developed a psychomotor exercise based while using the tablets in clinical practice, and it is using the scoring of the tablet. I will be showing it in the later parts of my discussion. So scoring in the tablets are also having, as I already told, the regulatory authorities, they are having certain kind of the recommendations for the manufacturers. The split dosage should be at least the minimum therapeutic dosage of the medications. The split pill should not create a toxicity hazard. Drug which could not be split should not be scored with a groove. They are stable for the expected temperature and the humidity. The split pill should have an equivalent effect to that of full tablet or the part of the tablet at an equivalent dose. So as such, the drug authorities are also having these recommendations. So it is important to know that if a tablet is not having any scoring, it should not be divided, or it should not be used half tablet or 1/3 tablet, because it is meant for usage in the whole of the tablet. Scoring is only made in those tablets where manufacturers are allowing that these dosage can be divided, and if it is also fulfilling these regulatory authority criteria also. So there are certain kind of the advantages of the scoring in the tablet. They are facilitating administration in the clinical practice. They are reducing the cost and adjusting in the dosage adjustment. They are facilitating the dosage alteration. How the scoring is facilitating the administration? There are the several factors which can influence a patient inability to swallow a large tablet. Say for example, we are sometimes having a patient or dysphagia who are having the difficulty in swallowing. There can be a patient in the clinical practice in moribund states. There can be age related psychological changes. We can have pediatrics patient. All these in all these clinical conditions, we are having the advantage of scoring in the tablet. Apart from that, they are reducing the cost and adjust dose. So when a higher therapy dose is no longer needed in clinical practice, the patient may split a tablet to save the cost of the tablet. The price variation among the different tablet strength is typically minimal. So requesting a higher dosage tablet strength in order to partition the tablet can be more economical as compared to using the whole of the preparations. They are also facilitating the dose alterations. Dose alteration involve the changing marketed dose to achieve a target dose. Hence, when in cases of the in clinical scenario, we need tapering of the dose or dose titrations, scoring of the tablet may help. Dose tapering refers to starting a medication at a higher dose and then slowly decreasing the dose to wean the patients out of the medications, as we are doing this in cases of the oral steroids using the methylprednisolone tablets in cases of some allergic reactions or for short term of use. Dose tapering is typically done to prevent the effect of the medication withdrawal also. In cases of the medication withdrawal, it is often associated, if it is often associated with clinical adverse drug reactions, then scoring can be helpful. Dose titrations as such refers to starting a medication at a lower dose and slowly increasing the dose to a target level. So the tablet splitting provide proper dosage in cases where slow dosage titration and dose tapering are necessary, particularly with the medicines that control the central nervous system. And recently it has become a more of the practice for the pharmaceutical company to manufacture the tablets of the multiple dose strengths. So in some cases, a lower desired strength may not be available. In that case, in that clinical scenario, we can use the scoring tablet or score tablets in cases of the clinical practice. Apart from the various advantages, there are the certain disadvantages that are associated with the scoring in the tablets. Tablets with the low hardness, with high friability, they can crumble or shatter during the process of splitting or partitioning, and this can compromise the desired dose of a particular drug. Also, in a patient with complex dexterity issue using the left hand or the right hand, they may be having difficulty in splitting the tablet. A drug of narrower therapeutic index, say for example the lithium carbonate in cases of the mania, uneven splitting tablet may lead to administration of a incorrect dose. So these are the various disadvantages that are associated with the scoring in the tablet. Now coming to the various type of the tablet that we are using in case of clinical practice, we are having different marketing preparations. We are having dispersible tablets, effervescent tablets, chewable tablets, sublingual tablets, sugar coated tablets, film coated tablets, antric coated tablets, and the extended use or sustained release form. Now in coming slides, I will be going one by one. A dispersible tablet is a tablet that disintegrates in water or other liquid. These dispersible tablets disintegrate quickly in the water or disperse immediately in the mouth. They are useful for children and frail elderly patients who face difficulty in swallowing a tablet. For effective use of this dispersible tablet, it is need to be kept in mind that these tablets are to be dissolved in a spoonful of water and then they should be given orally. So these kind of the practical communication we need to be carrying during the use of the dispersible tablet in case of the clinical practice. In cases of the effervescent tablet, in addition to the drug substance, these tablets may contain sodium bicarbonate and an organic acid, say for example tartaric acid or citric acid, and in the presence of water, these additives, they are reacting and liberating the carbon dioxide, and this carbon dioxide is acting as a disintegrator, and this is producing the effervescence, and this evolving gas during the process of effervescence may exert a carminative function and also may be having a psychological effect during the swallowing of the tablet. So these tablets should be stored in a very airtight container, and that is there is a need to avoid from the moisture, and so their container should be moisture proof, and they should be labeled to indicate that they are not to be swallowed directly. They needs to be dissolved first, and then after dissolving they should be used. So for effective usage of these doses in clinical practice, we need to give advice that these tablets to be dissolved in a glass of water, and then the same of the can be taken orally while effervescence is still present, and taking it in an upright posture, either standing or sitting position. Now coming to the chewable tablet, I am showing the screen the Zental, very popular anthelmintic tablet, which is a chewable tablet. These chewable tablet disintegrates due to creamy base. Example: antacid tablets, anthelmintic tablets, and vitamin C tablets. They are very useful for the children who are having difficulty in swallowing, and in cases of the adults who dislike swallowing. The chewable tablets are convenient alternative to a conventional tablet, and they are lacking disintegrants as such, so their action would be slow if they are swallowed without chewing. For effective use of these tablets, we need to carry certain kind of the advice during the clinical practice, that these kinds of the chewable tablet should be broken and they should be chewed before swallowing, and swallowing with a little amount of the water if required, with the patient in upright posture, either sitting or standing position. Now coming to the mouth dissolving tablet, these are readily soluble when placed over tongue, and with the saliva in the mouth, the saliva only is sufficient sometimes to dissolve these tablets uh, in the mouth or the tongue itself. They are pleasantly flavored. Excipients are sometimes added to these kind of the tablets to enhance their palatability. Advantages of using these kind of the tablet, they are very helpful in cases of the nausea and vomiting. I have already shown you the example of the ondansetron tablet that is being used in cases of the nausea and vomiting. Now coming to the buccal and sublingual tablet. Sublingual tablet, as we know, it is derived from the Latin word under the tongue. It refers to the pharmacological routes of administration by which the substances it is diffusing in the blood through various tissues under the tongue. The cheek, in our oral cavity area under the tongue, the area under the tongue, it is having a lot of capillaries and very tiny blood vessels. So these medications can be absorbed directly in the bloodstream without needing to go through the digestive system. Some drugs that are administered in this way, including the cardiovascular drugs, we are having very popular drugs in the form of the sorbitate or isosorbide dinitrate, which is being put under the tongue when a patient is developing a case of the chest pain of the angina, and it is can be spitted after the desired effect is completed, and it is producing almost an immediate effect in these cases. It is advisable to hold the sublingual tablet to under the tongue for a prescribed length of the time only, and most of the medication they should have dissolved by the time they are usually taking 2 or 3 minutes under the tongue. So sometimes the peak blood levels of most of the products that are administered sublingually, they are achieved within 10 to 15 minutes, which is generally faster than the same drugs when they have been ingested orally. So the sublingual absorption is sometimes even better than the oral route, and the percentage of each drug is generally higher than that is achieved by means of the oral route. So this is the advantage of using these sublingual dosage forms. Now coming to the coating of the tablets, the coating on the tablets is being done for a variety of reasons. They are including the protection of the ingredients from the air or moisture, masking the unpleasant taste or odor, improvement of the appearance of the tablet, control of the site of the drug release at the gastrointestinal tract. Now coming to the one by one, here is an example of the sugar coated tablet. These are compressed tablet. I have also shown you during the video how the sugar coating is being done on the tablet. These are compressed tablets containing the sugar coating. Such coating may be colored sometimes, and they are beneficial in covering up the drug or substance possessing the objectionable taste or odor, and in protecting the material sensitive to oxidation. So for all these purpose, sometimes sugar coating is being done, and sometimes it is also having a disadvantage. Disadvantage is that its action is slow and it is tardy, and sometimes it may not be suitable in cases of the emergency. And it is important when we are using the sugar coated tablets. In case of the clinical practice, we need to give advice to the patients is that for effective use of sugar coated tablet, they should be swallowed with a glass of water with the patient in upright posture, either with sitting or in standing position. Now coming to the anti-coated tablets with substance that resist solution in the gastric fluid but disintegrate in the intestine. For this purpose, anti-coating is being done on the tablet. They are being used for the tablets which are containing the drug substance that are inactivated or destroyed in the stomach. It may irritate the mucosa, or as such, it is a means of delayed release of the medication. For effective use of the anti-coated tablets, we need to give advice that these patients should all be taken in a whole form, and they should be swallowed with a glass of water with the patient in upright or in standing position. Now this is the feature of the modified release tablet. These are almost synonymous with the controlled release tablet, delayed release tablet, prolonged release tablet, sustained release tablet, timed release tablet, or sometimes they are also called extended release tablet. Here I am showing you again a video. You can have a look how the anti-coated, this is immediate release layer, this is controlled release layer. When a patient is taking the tablet, how it is being dissolved, how it is traveling inside the body. So it is traversing through the intestine. All these kind of videos we are showing to the undergraduate student during the practical class. This is to enhance their interest for the solid dosage forms. This is the graphic illustration of the drug release. So the contents of the drugs you can see are slowly released over a period of time. This is the example of the Prexel tablet which I have shown in the video. This is again showing a graph which is showing the plasma concentration against the time. of the immediate release tablet against the sustained release tablet. We can see very well from this graph that the concentration of the immediate release tablet is going rapidly with the passage of time, while in cases of the sustained release or slow release tablet or modified release tablet, it is being released over a period of time. This is the lozenges, which are small but usually sweetened and flavored medications that are designed to be held in mouth for slow dissolution, especially one that contains a demulcent, as in cases of the sore throat. And this is the picture of the sore throat lozenges, and they can have a local effect due to the presence of the menthol in the tablet, and they are having very soothing effect on the mucous membrane of the throat. For effective use of these kind of the lozenges, we need to give advice to the patient that these lozenges should be sucked, and as such they are not meant for chewing purpose. So they should be slowly sucked over a period of time, slowly in the mouth. Now coming to the capsule, a capsule is usually containing a body, a cap. It is having an air vent. It is showing the typical picture of a capsule where it is being shown in a pre-closed position, and then in a closed position. That is the locking status of the capsules after filling of ingredient in the capsule. It is having a body and cap. It is having dimples. There are certain snap fit grooves. They are usually having the active ingredients, which is actual substance which is having the pharmacological activities. They may be having diluent. Sometimes lactose is being added to fill the capsule, and it is also causing rapid dispersal of the drugs in the gastrointestinal fluid. They may be having lubricant in the form of the magnesium stearate, which is being used for ensuring the flow of the powder during filling purpose. While these capsules are being manufactured by the pharmaceutical company, they sometimes may be having preservatives. Soft gelatin shells may contain a preservative to prevent the growth of the fungi. The commonly used preservatives that are being used in manufacturing of the capsules are the methyl or propyl parabens, sometimes sorbic acid also. So capsules may also be having various sizes. They may be having, they may be ranging from 2 millimeter to 18 millimeters. 00 is holding about 1,000. It is denoting 1,000 milligram capsules. 0 size hold be about for 500 milligram. 1 hold 250. 2 is 200. 3 is 150 milligram. So you can see very well how the effect of size of the tablet capsule may affect. So it is being promoted that a smaller size of the capsules is easy to swallow by a patient. So pharmaceutical companies sometime during the process of the manufacturing are trying to make smaller and smaller capsules, so for the ease of the administration during the clinical practice. This is the slide which is showing you the various types of the capsules. We are having hard capsules, soft capsules. We are having modified release capsules. These hard capsules, I am showing here the amoxicillin capsules and fluoxetine capsules. They contain shell that is having two parts, a body and a tightly fitting cap. The diameter of the cap is sometimes slightly larger than the diameter of the body. I have already shown in previous slide. The gelatin capsule is sometimes colorless. It is being made colorful or opaque for differentiation purpose by adding the colorant and the opaque producing substances such as titanium oxide The capsules sometimes may be having an imprint of the monograph from the manufacturers, which is showing the strength on the capsule itself. They can be having a coding designation for the purpose of the identification. Sometimes they may be having symbols to distinguish from other capsules. The size of the capsules may range, I already told, from 12 millimeter to 28 millimeter, and I have shown you the various sizes of the size in my previous slide. We are having then soft capsule. Soft capsules are prepared from the shell of gelatin to which glycerin or sorbitol has been added, and this addition of the glycerin or sorbitol, it is being added to render the gelatin elastic or plastic-like. There are the various shapes, such as, say for example, they may be available in the form of the round capsules, oval capsules, oblong tubes, or suppositories. Sometimes they are containing either liquid suspensions, pastry material, or sometimes they may be filled with the dry powders. It is important to note that the necessity of using the soft capsule is to seal this with liquid medication within the capsule itself to prevent the medication, especially susceptible to deterioration in presence of the air, and to use the volatile medication. In addition, the soft capsule may easily be swallowed. So they are available in the market. We are having as an example vitamin A capsule, vitamin E capsule, which I have shown in my slide. Now coming to the modified release capsule. Modified release capsule are either hard or soft capsules. The drug in the granule form sometimes are present within the capsule itself, and its coating is present with a variety of substances that are designed to dissolve at different time over a period of time. In my previous slides I have shown you, and sometimes some of these modified capsules may take for releasing of the tablet. It can take time from 2 to 12 hours depending on the coating that are being used in cases of the modified release capsules. And we are having various examples of the modified release capsules in clinical practice. Say for example, iron capsules are available. Sometimes ordinary tablets are being taken. The frequency of administrations may be reduced to once daily by using the modified release capsules, because I have already shown that they are being released, the active ingredient is being released over a period of time. Another kinds of the preparation, the solid dosage forms, are the oral powders. They are mixtures of the finely divided drugs or chemicals in the dry form. The advantages of powders as a dosage forms are flexibility in the compounding process. Relatively, they are having good chemical stability, but sometimes powder are not suitable for dispensing the unpleasant tasting drug. Oral powders are preparations. They are consisting of the solid, loose, or dry particles of varying degree of fine particle size. They sometimes contain one or more active substances with or without excipients, and if necessary, approved coloring material and flavoring agents may be added. They are generally administered in with water, and sometimes another suitable liquid are being added, and they may also be swallowed directly. They are presented as a single dose or sometimes as a multi-dose preparations in suitable containers. Here I am showing you the oral powders, which is calciferol granules. In cases being used in cases of the vitamin D deficiency, in cases of pediatric patients. Then there are the granules. Another important solid dosage preparations, they are small irregular particles ranging from 0.5 to 2 millimeter in diameter. It is more stable physically and chemically than corresponding powder from which they are being prepared. Granules may be placed over the tongue and sometimes they are being swallowed with the water. The granules may not only contain the active ingredient, but sometimes they may be having colorant, flavorant, and other pharmaceutical ingredients also. Now, after covering almost all the solid dosage preparations, I will be discussing here some key points that needs to be kept in mind while using the solid dosage forms, and they needs to be communicated to the students of MBBS level, because they are very much helpful uh, for keeping the various things when using these solid dosage forms in clinical practice. One important point is that the tablet and capsule, they should be removed from their strip just prior for their use. It is not a good practice for removing this capsule or tablet from the strip, because they may be decaying, there may be environmental effect on the tablet or the capsules. So they just needs to be removed from their strip prior to their use. And it is important to note that the interaction of the medication with the food. If a particular medication needs to be used as an empty stomach, it should be specifically advised, and for practical purpose, it is considered 1 hour before or 2 hours after having a meal. So when an empty stomach, a preparation needs to be given with an empty stomach, this important clinical point must be communicated to the patient while using the solid dosage form. The capsule and tablet that are meant uh, for swallowing purpose, they should never be crushed, and it is important to use the water, and it is recommended to facilitate swallowing the tablet or capsule preparations. The suitability of these tablets or capsules with other liquids, say for example the fruit juice, milk, yogurt, they can be checked with the manufacturer provided information, which is sometimes being provided along with the packing itself. Now, for those patients who tilt their head backward while taking a tablet, they may expose the posterior part of the taste bud. Here I am showing you the tongue map, and you can very well see that the posterior part is more sensitive for the bitter taste, and sometimes while tilting, they are exposing the posterior part, and it may result gagging or sometimes spitting out whole of the preparations. So ideal is preparations should be placed gently on the tongue, and they should be taken quickly with the small sips of the water. Here sometimes we are having the patients who are having a lot of fear with the pill swallowing, so we can suggest some methods. There are two methods to help swallowing of the tablet. In cases sometimes we are having some patient who are having psychological fear while swallowing the tablet. So there are two methods: pop bottle method for the tablet and lean forward method for the capsules. The dispersible tablet can be an alternative for those who are finding difficulty with swallowing the tablet or capsule. For patients with the dysphagia especially, they are also having a lot of difficulties in swallowing. So these pop bottle method for the tablet or lean forward methods can be advised. Sometime for pill swallowing, there are the specialized cups available in the market. For swallowing tablet, they invoke which are invoking a fear of choking. These kinds of the cups may be used. They are commercially available in the market. on the Amazon websites also, and they can be used in cases of the dysphagia patient who are having multiple problems, say for example multiple sclerosis and Parkinson's disease. They can be, these cups can be used. They are having feature of having a special mouthpiece into which a tablet or capsule can be placed. The pill is then carried out in the mouth via the liquid flow, and the pill and the liquid mix is concurrently swallowed along with the swallowing reflex is over. So they are an aid for swallowing method in cases of the patient who are having a lot of fear in swallowing, or sometimes patient is already suffering with certain kind of the dysphagia. This is the picture which is our pharmacy lab. In our pharmacy lab of SMH Government Medical College, we are having almost all kind of the solid dosage preparations, and we are using these kind of the preparations during the exam in a tray, and examiner during the course of the viva, by showing the a particular preparation, they can give the particular preparation in the hand of the student and can ask the various questions that are related with the preparations. This is one method of practical exercise related to the solid dosage form. Apart from that, I have taken another way of using the scoring of the tablet, the criteria, and I have developed an exercise. It is having little bit psychomotor activity, and it is using the pill splitter. Here is the case of 48-year-old male which is admitted to inpatient psychiatric hospital with 1 month of behavioral changes, including the irritability, decreased need of sleep, hyperverbal speech, hyperphagia, and paranoia, 5 months after traumatic brain injury. So this patient is being diagnosed with bipolar disorder, and it is very common after traumatic brain injury, and it is also having the maniac features, and the psychiatrist or the clinicians have advised atypical antipsychotic olanzapine in this particular case, and this patient has been asked to start 5 milligram per day of medication and gradually increasing this tablet 5 milligram per 24 hours up to 20 milligram per day depending upon the response. And tablet olanzapine is available in the market as a 10 milligram preparation as a score tablet. So in this particular condition, either we can take a 5 milligram tablet or 10 milligram tablet or 20 milligram tablet. Here I have chosen the 10 milligram tablet, and with the help of the pill splitter, on the first day this patient is using 5 milligram, and he's with the help of this pill splitter he is dividing it into half. So on the day 1 he is using olanzapine 5 milligram tablet, and if he is not getting desired response, then on the next day he can take the full tablet. If he is still not getting the response on the next day, he can tablet full tablet, and again he can divide a tablet in 2 parts, and on third day he can use 1.5 tablet. So in this particular exercise, the examiner may ask the students scoring in details. He can discuss the advantages of using the score tablet in clinical practice that I already discussed in my slides. He can discuss the pill splitting method and demonstrating the use of the pill tablet splitter to obtain a particular desired dose in clinical practice. And he may ask what is the use of rationale of using the score tablet of 10 milligram in this particular case. So all this particular exercise is just to incite a kind of interest among the students related to the solid dosage form. It is just an exercise. Similar kind of the exercise may be developed using the another solid dosage preparations. So this is a method for initiating the viva, that he can start the viva of the student with the pill splitting technique, and then he can discuss with the students of the various kinds of the tablets that are available in the clinical practice, effervescent tablet, mouth dissolving tablet, chewable tablet, sublingual tablet, sugar coated tablet. So he can initiate from here. This is one matter we are using in our department. So going ahead, he can discuss on the aspect of the scoring. I have already discussed is what is the scoring, what are the various criteria that a manufacturer is considering while making a scoring in particular condition. Then regulatory authorities. I have already discussed the advantages of the scoring in the tablet. These are helpful in facilitating the administration. Here, in cases of the dose alteration, which is very much important in this particular case, because we need, with the passage of time, we need to increase the dosage of a tablet. So the scoring and accurate splitting of a tablet is important in this particular case. And if it is being done with the use of this splitter, it can be very much beneficial. These pill splitter, they are breaking the tablet, and they are more useful as compared by breaking the tablet by the hand, because breaking the tablet by hand may give unequal portion, and a part of the tablet sometimes may be crushed during the breaking process. So pill splitter is a simple and inexpensive device to split the medicinal pills or tablet, comprising the some means of holding the tablet in place. So during the uh, splitting purpose, tablet may not be out of the hand. It is usually having a blade which is easily in a compartment, and sometimes the half of the tablet can be stored. The tablet is being positioned, and then blade is pressed down. This is the picture in next slide, how of the use of this pill splitter. I have purchased the one pill splitter uh, 2 weeks before from the Amazon. It is very cheaper, available on the Amazon website, costing around 200 rupees only. Here I am showing you the video of how to use this pill splitter. So here we can show during the practical exercise, during the examination, that the students are being given a tablet which is scored. Say for example, we have used olanzapine. So he may show how accurately this tablet can be broken in two parts by using this pill splitter. So it is accurately dividing the tablet into two equal parts. This is the method how to use this tablet splitter. And rationale of using the 10 milligram tablet in this particular case is that this patient can be given a 4 tablet of olanzapine, and he can be advised to start with the half tablet a day, then 10 milligram spore tablet, and those can be adjusted easily by giving half tablet day 1, full tablet day 2, 1.5 day tablet, and 2 tablet at day 4. These are the references for the further readings. Now the house is open. Thank you very much for your patient listening. Now the house is open for any kind of the questions. Sir, can you hear my voice?
Yes, Dr. Kamaal, we can hear you. I was just wondering, Miss, you have taken it as if, Miss, as the whole practical is taken, which is actually not the purpose of this particular meeting. But you have also explained how you do the ask the exercise and discuss with them. I want to know that when this is a competency, how do you think we can accomplish it? How we should give the practice and how we should plan that, means that entire practical. Are we going to tell them using the PowerPoint as you have presented, or because it is, I think they have to do some active learning in CBME, and also they should be allowed to practice. So have you given thought to that particular aspect? Because
We
everyone
usually
we are wondering about this.
at
Yeah.
the time of the exam, as I already suggested, we are having a tray in which the various kind of all the solid dosage preparations are available. We
Correct.
are showing
That
you.
is for the assessment, but during the practical, means we will be having only one practical for that. So how we should give them the practice? Because whenever we talk about the competency, there has to be a practice to that. Only giving them one lecture or giving, as we used to do earlier, presenting, showing them the dosage forms, that is not enough. So now how to give them practice, because our duration, we don't have multiple practicals also. So anything
Yeah.
you have thought about it?
This is one kind of the psychomotor exercise that I have had the idea. I have come across in psychiatric patients that pill splitting is being done, and where the scoring is having a lot of consideration in clinical practice. So this kind of the psychomotor exercise can be used in case of the student when they are appearing for a particular VAVA. This can be on with the help of the station, on a particular station that particular pill splitter is being kept, and a simulated student patient is sitting and is being advised for certain kind of the medication, say for example olanzapine in this case. Just a method of evaluation of the solid dosage form. Apart from that, nothing is being left with related to dosage form, especially in pharmacology department. With the obviating the use of the pharmacy exercise, because we have displaced all the pharmacy preparations, only oral rehydration salt is there. So we need to develop some another methods of assessments. That is my idea.
Okay. So
Apart from that, I have also having another exercise which I have not discussed because of the paucity of the time, is that we are giving the same preparations, say for example amoxicillin in the form of the tablets and in the form of the capsules, and apart from the other discussion, then we are asking students what are the various advantages of using the tablet preparations, and what are the various advantages of the capsule preparations, and we are giving them a particular case. Then we ask a student by using his brain or his IQ, he is telling us what he is choosing in that particular case, whether he is choosing the capsule or whether the tablet preparations. That is another exercise, I mean to say.
So are there any questions? Dr. Sanjay?
I don't see any. There's only one hands, but there is, I don't know, there is raised for almost half an hour. Dr.
Okay.
Avula Namin.
Okay. So thank you, Dr. Kamaal. Yeah.
I don't see any hands nor any messages.
Okay. 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 They will ask in the group, maybe perhaps. Thank you. Thank you, Dr. Kamaal.
Thank you, sir. So I think we can end it here now.
Yeah. Yeah, Dr. Sanjay. Thanks.
Dr.
Uh-huh.
Dr. Anjali Varghese is asking, can we split unscored tablet? Unscored tablet, is it something? Okay.
Thank you, sir.
Thank you, sir. There's a question, sir. Can we split unscored tablet by Dr. Varghese?
No, sir. We cannot split the unscored tablet because I have already told during the presentation that pharmaceutical companies are only making scoring on those tablets which can be divided. So it is not advisable at all during clinical practice if a patient under the misconception he is using is dividing a tablet which is not having scoring, it is not justifiable for clinical practice. Ideally only score tablet can be divided in various parts. And pharmaceutical companies deliberately only producing scoring on those tablets only which can be divided, not on those tablets. So absence of the scoring itself is telling us that it is not justifiable to divide a tablet into half or other dosage.
Fine, sir. Thank you, sir. So we end it here now.